94.1 WHRP, today's best variety of R&B. It is Wellness Wednesday. Tony in the morning and DJ Primetime 256 and Dr. Whitney West, MD, PC, gynecologist. And Dr. West, how you doing this morning?
I'm doing great this morning. Thanks for asking.
Fantastic. And today, of course, last week we talked about Breast Cancer Awareness Month. It's October. We're going to talk about the Pap test exam and the importance of getting one. But first, before we get into that, tell us what a Pap test is.
Pap test is a screening test for cervical cancer. So we take a little of the cells off and then we send that to the lab. And that tells us those patients who need further evaluation.
It's going to sound a little crazy now. Dr. West, who all can get a Pap smear? Men, women?
Women who still have a cervix.
And how old should you be when you first get your exam?
Guidelines are now 21, and they've been that way for about a decade or more.
Okay. So at 21 years old, we are encouraging our young women to get their Pap exam. And those who have been getting Pap exams for quite a while, how often should you have one?
Depends on your situation, but between ages 21 to 29, it could be yearly because you'll be seeing maybe for birth control pills and stuff like that. You'll be getting your evaluation, but 1 to 3 years, depending on your situation. At 30, then it could be 3 to 5. Again, depending on your situation. The guidelines are based on average risk. So if you're a higher risk, you're going to be seen more often. If you've had an abnormal one before, you're also going to be seen more often and you're going to have additional testing done.
Talking to Dr. Whitney West, it is Wellness Wednesday, and we're talking about Pap test. Last week we talked about breast cancer awareness and the self-examination. Is there any way that we could check for ourselves to even know if we have a possibility of cancer with our cervix before we get an exam?
So there's no checking for the individual. That's why you need to actually come in to be seen and evaluated. But there are some signs. I mean, if there's irregular bleeding or something like that. But we'll be able to, as a physician, we'll be able to evaluate that for you and then suggest your follow-up time frame.
What all does a Pap smear check for? Does it just check
just looking
cancers? Is it STDs? What all does it check for?
So we're just checking in the Pap test itself. We are just doing cervical cancer screening. There's a box that we can check on. Some of the labs would allow us to actually check for some sexually transmitted diseases, but that's not the typical way that we would do STD screening. So prior to 21, if STD testing is needed, we have other ways to do that. So you don't need a Pap test to have STD testing.
All right, Wellness Wednesday with Dr. Whitney West. And how important is the cervix for a woman?
Well, the cervix is the end part of the uterus, and that is what we're looking for when cervical cancer is what we're looking for those who have a cervix. Those who have had a hysterectomy, which means that we remove that portion of we move that organ. Vaginal cancer is rare, but those who have had abnormal Pap smears prior to having a hysterectomy will still need to be followed, depending on what their situation is. But typically, if you've had a hysterectomy, you don't need a Pap smear anymore because you no longer have a cervix.
And one more question: is this a genetic possibility when it comes to cervical cancer?
So no, cervical cancer is actually one of the GYN cancers that is not genetic. It is actually more environmental. So we want to avoid those things that are going to increase our chances for getting cervical cancer, which includes smoking, multiple sex partners, and stuff like that.
All right, let's follow Dr. Whitney West on our social platforms. How can we follow you?
I'm Doc Whitney W on Instagram, Dr. Whitney E on Facebook. My website is www.westmdpc.com. Phone number 860-337-9378.
And any parting words, Dr. West?
Empower Wellness is a journey, not a destination.